Okay, today my presentation is on absence seizures, also called Petit model. This is a neurological presentation by Teresa Hearn Haynes from Washington School of Health Sciences in San Pedro, Belize. We're going to be discussing the pathophysiology, the definition, the risk factors, the symptoms, characteristics, how long they last, what it's like, the causes, the triggers, the diagnosis, and the treatment. The absence, this is the pathophysiology. They did on rats, not on humans, but according to this particular prototype, it derives during the brain maturation, I guess during embryology, okay? With the rats having spike and wave discharges recorded on the EEC. That's the hallmark of the absence seizures. And they offer strong face validity with the human pathology. So they're using this model to study absence seizures in humans. This is the picture of the brain, of course, and this is the area that it appears to begin in, which is the somatosensory cortex. The definition of absence seizures is generalized onset seizure, which begins on both sides of the brain at the same time. The prevalence is in childhood between the ages of 4 and 14. In childhood absence epilepsy, in which typical absence seizures are the only type of seizures suffered by the child. Seizures generally cease spontaneously by 12 years of age or sooner, or at least by puberty. Less than 10% of children develop infrequent generalized tonic-clonic seizures, and it is rare for them to continue having absence seizures. The risk factors. The absence seizures are more common in children between the age of 4 and 14, and are more common in girls. And family members who have seizures, nearly half of the children will have absence seizures if a close relative has that. The symptoms of an absence seizure is staring into space for a few seconds, a sudden stop in the motion without falling, lip smacking, eye fluttering, chewing movements, cognitive problems such as difficulty in paying attention, rhythmic muscle contractions, and stopping speech midway. The characteristics of absence seizures is that they're characterized by lack of awareness of consciousness for just a few minutes. It is a generalized form of epilepsy following both sides of the brain and can occur up to 100 times or more per day. The body tone is not lost. They do not fall or have urinary or bowel incontinence. The motor activity are automated, which is eye blinking, head bobbing, chewing, smacking usually occur. It can be triggered by hyperventilation. And typical EEG findings are spike and wave complexes that occur every 3 seconds in intervals. Ethosuximide is the first line pharmacological treatment along with other anti-epileptics, beginning with the lowest dosage and working your way up. How long do they last? Most seizures last between 5 seconds and 30 seconds, but they can last for a few minutes. Although this is less common, the longer the seizure lasts, the more likely it is to be noticed by others. Usually it's not noticed because it happens so quickly. And absence seizures may be frequent, 10 or more, up to 100 times a day. And some children can have hundreds a day. What it's like to have an absence seizure. When people have absence seizures, they are not aware of what is happening around them. They have this blank stare. I'm going to show you a YouTube video of a brave young man who has recorded his absence seizure, so you can see exactly what it looks like. If a person is speaking when their seizure begins, they will stop talking in the middle of a sentence. And often a child may have many seizures in a row. Observer may not see the beginning or the end. The causes of absence seizures is, in general, caused by abnormal electrical impulses from nerve cells in the brain. The brain's nerve signals normally send electrical and chemical signals across the neurons in the brain. The brain's nerve cells send electrical and chemical signals across the synapses and connect them. And people who have seizures, the brain's usual electrical activity is altered. During an absence seizure, these signals repeat themselves over and over in a 3-second pattern. People who have seizures may also have altered levels of chemical messengers that help the nerve cells communicate with one another through neurotransmitters. What happens in the brain during an absence seizure? The brain nerve cells normally send electrical and chemical signals across the synapses that connect them. And this usual brain activity is altered during an absence seizure, resulting in these electrical signals repeating themselves over and over and over again in 3-second intervals. The triggers for absence seizures are the same as for other types of epilepsies, which are lack of sleep, not taking their medications, emotional stress, worry and excitement, breathing heavily, sounds, flashing lights, bright sunlight, withdrawal from benzos and other central nervous system drugs, the use of medications that make seizures more likely, such as isoniazid, is a drug that treats tuberculosis, or antipsychotics, which is a class of drugs which used to treat mental health conditions. The use of alcohol or other drugs do not help. The diagnosis of absence seizures is the most common neuroimaging test for epilepsy is CT scan and MRI. Both procedures are pictures of the brain, how it looks and works. The MRI is preferred because it provides more information than a CT. MRI is recommended as the image of choice, which is the state of the art. The diagnosing absence seizures is blood tests, tests of the kidneys and liver, MTR, MRI scans. A spinal tap can be used to check the cerebrospinal fluid. This is a picture of MRI of a person who's having an absence seizure. And you can see that it's mostly in the frontal lobe in all of these pictures, mostly in the frontal lobe, but then it travels general to the entire brain, but that's where it begins. The blood tests that are used to identify absence seizures is the level of prolactin in the blood increase during these seizures. That's one of the ways to confirm the diagnosis. EEG and EKG are used in the diagnosis of absence seizures simultaneously, so you can monitor the heart as well as the electrical impulses. This is an EEG of an absence seizure, characterizing the 3 Hertz spike that happens every 3 seconds. This is another one. And that's a toddler who's having an absence seizure, just staring blankly into space. The causes of absence seizures, there's a genetic predisposition, as we talked about earlier with the family having some family history of absence seizures will increase the risk. The way to prevent absence seizures is through getting plenty of sleep, manage the stress, and eat a healthy diet and exercise regularly. The complications, many children outgrow this condition, especially by puberty, and the condition may persist throughout life to tonic-clonic seizures. It can lead to full conversions, learning difficulties, behavior problems, and social isolation, because a lot of the young children that have this isolate themselves because it's embarrassing to them, to other children. So how are they treated? They're treated by anti-seizure medications. And as I said earlier, the ethosidamide is the mainstay. That's the first line of treatment. So those are the drugs that are used to prescribe for absence seizures. As we said, the first line is ethosidamide, and valproic acid is another one. But just about any anti-seizure medication can be used, but the first line treatments are ethosidamide. That's the video I'm going to show you in a few minutes, and those are my reference, and thank you for your attention. See if I can get to this. Let's see, how do I escape? There. Okay. Thank you. I'm trying to get out of here. Let's see. Okay, there it goes. Okay, so I'm going to show you now what the absent seizure looks like. Go back to my. I'm sorry, I don't know how to get to it. Well, anyway, I've sent the link is in the presentation, and you'll be able to see what it looks like because I can't seem to get that screen to come up.
Okay. I'm talking. Well, welcome to technology. Hey?
I know had everything already ready.